Hey pet parents, in this video we're going to be talking about canine and feline multiple myeloma. Hi, I'm Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home. One way in which we do this is by producing this channel. We want to help the millions of Americans who do not have easy access to veterinary oncology get the information they need to make informed decisions for their furry family members. So if you give us a like and hit the subscribe button, you'll be paying it forward. That helps us keep this channel running and providing that much needed information to anyone who needs it. Okay, so what is multiple myeloma? Well, this is a cancer of the immune system, a specific cell in the immune system called the plasma cell. Normally, these cells are involved with producing antibodies, little proteins that are needed to tell the immune system to do something, attack a bacterial invader, or start producing chemicals to make the environment inhospitable to viruses. So plasma cells produce antibodies. When these cells become cancerous, there are way too many of them. So there's too much of one type of cell within the bone marrow and in the blood. Those cells can crowd out normal cells. They can also produce way too many antibodies. And when I say the word antibody, for the purposes of this video, think protein. So now you have all of this protein kind of sludging up the blood, which can cause all kinds of problems. So what are the clinical signs associated with multiple myeloma? That could be lethargy, decreased appetite, pain, or lameness. So when these cells fill up the bone marrow, they can start to destroy the underlying bone, which is very painful. And if they're producing all of those antibodies or protein and making the blood really thick, you can get really high blood pressure, which can lead to sudden blindness, can also, in rare cases, lead to seizures. So multiple myeloma is a pretty serious disease. Diagnosing multiple myeloma is usually relatively easy. So we may see some changes in the lab work that could be associated with a few different types of cancer, like low red blood cells, low white blood cells, low platelets. But there's only a couple of things that can cause a significant elevation in those protein levels, those antibodies or globulins specifically. Multiple myeloma is by far the most common reason to have an elevation in your globulins, but sometimes certain types of infections can do it, other types of cancer can do it. So we'll often run another test called an electrophoresis. This gives us more specific information about the globulins, specifically what types of globulins are elevated. Is it only one type? Is it multiple types? If we're only seeing one type of globulin elevated, that is probably being produced by a clonal cell. One cell that has divided over and over again is producing the same kind of globulin. That's usually associated with multiple myeloma. In some cases, the pet may also have lymphoma. Sometimes B-cell lymphomas can overproduce globulins, and you'll get the same result in electrophoresis. So ultimately, if we want to be super sure that we're dealing with multiple myeloma, we would have to do a bone marrow aspirate. And then we'd physically see those plasma cells overcrowding the bone marrow. I'll be honest, I don't always do that test. It requires anesthesia. It's relatively expensive. Under anesthesia, the procedure is not painful, so I'm not overly concerned about that. But it's a big deal to do a bone marrow aspirate. So if I have a patient who has all the signs of multiple myeloma and also has an elevated globulin level and has only one type of globulin elevated in their electrophoresis, I'm going to treat them for multiple myeloma. So what does treatment look like? Well, treatment does involve chemotherapy, and please don't tune out. Chemotherapy in veterinary patients is very different than it is in human patients. I mean, sometimes we are using the same drugs, but we use them at lower doses and sometimes different schedules because, well, we really are trying to maintain an excellent quality of life while patients are going through treatment. So the typical way that we treat multiple myeloma in both dogs and cats is with a chemotherapy drug called melphalan. This is an oral pill that's given, well, I was going to say every other day, but there are a lot of ways to give melphalan. Sometimes people do 10 days on, 10 days off, or a higher dose for 10 days and then a much lower dose at every other day for the rest of the patient's life. There are a lot of ways to dose this medication, but it's an oral pill that parents give at home. Sometimes I'll also mix that with steroids. Steroids can be very helpful in reducing the number of cancer cells in a short period of time. But the effects of steroids don't last for very long. So we really need that chemotherapy on board to kind of keep that remission going. I will also treat patients with pain relievers if they need it. Like I mentioned earlier, multiple myeloma can affect the bones. It can destroy the underlying bones. It creates lytic lesions, these little punched out holes in the bone that can be very painful. So anti-inflammatories, sometimes opioids, sometimes a drug called pregabalin, another drug called zoledronate. There's a lot of ways to address that. Once a patient is in remission, we don't usually have to continue such aggressive pain management, but in the early stages, it's usually very helpful. Now, there's a newer drug that they use in people more often than chemotherapy, at least that's my understanding. It's called bortezomib, and this is a subcutaneous injection that's given twice a week. It's a little different than chemotherapy. In fact, it's a lot different than chemotherapy. Bortezomib is in a class of drugs specifically called a proteasome inhibitor, but more broadly, I would consider it in a class called targeted therapy. Chemotherapy is a little bit different than targeted therapy in that chemotherapy goes into the body and kills rapidly dividing cells indiscriminately. So any cells that are turning over quickly, chemotherapy is pretty good at going in there and kind of damaging the DNA and preventing the cells from dividing. Targeted therapy, well, is a little bit more precise. It targets specific aspects of cancer cells that are upregulated compared to normal cells. Or targeted therapy interferes with cancer cells' ability to repair DNA damage. And so with cells that are turning over really quickly, there's more chance for DNA damage. And if that happens, they could die. So cancer cells have, well, all cells have the ability to repair DNA, but cancer cells sometimes only have one or two ways of doing that because of all their mutations. And so if you interfere or you interrupt one of those pathways, sometimes the cancer cells cannot repair DNA. Proteasome inhibitors, they interfere with cancer cells' ability to basically clean house. So our bodies metabolize food and toxins and all kinds of stuff, and then we eliminate it. Well, individual cells do the same thing. They process things that are coming into the cell. They're processing proteins and molecules that they're making, and they eventually get rid of the stuff that they don't need. Well, one of the ways in which they do that is with proteasomes. So if you inhibit that process, they can't clean house, and then they eventually die. So that's proteasome inhibitors in a nutshell. This particular class of drug has been shown to be pretty helpful for humans with multiple myeloma. And in veterinary medicine, we now have access to this drug. So there is one case report, so that's only one patient of a cat with multiple myeloma who was treated with this drug, and it worked for the cat. The cat did pretty well for a little while. So there are multiple types of chemotherapy that we can use for multiple myeloma. My first choice is always melphalan. It's usually very well tolerated. We don't usually see it cause significant negative side effects. It can be given at home. It's relatively inexpensive. There are other chemotherapies that are potentially effective against multiple myeloma if melphalan doesn't work, but now we have this newer drug, this bortezomib, that might also be helpful if the chemotherapy isn't working anymore or is causing side effects. Or maybe we have a cat that the parents just absolutely cannot give pills to. I would consider bortezomib in that situation. Now, another way in which we try to help patients is with nutrition and supplements. I always advocate that my patients start eating more vegetables. Well, at least the dogs. This is really not possible in cats, and cats are obligate carnivores. And it's also very difficult to get any supplements into cats, so cats are kind of in a category of their own. But when it comes to dogs, I like to tell parents to try to add a variety of vegetables to their food: broccoli, cauliflower, Brussels sprouts. If the only vegetable they'll eat is carrots, fine, give them carrots. Any whole plant food is going to be rich in phytonutrients and antioxidants and other things that just basically help the immune system function better. And then when it comes to supplements, I have a few favorites. One that comes to mind is a mushroom supplement. There is a compound within the mushroom called beta glucans that in some studies have shown to increase the immune system's ability to fight cancer. And you can find several products out there that come in a chewable treat for dogs. You just have to be a little bit careful about how you pick supplements and which company you buy from and your source. So don't buy from Amazon. I am not an Amazon hater. Amazon's great. But they can't always control the environment that those supplements are warehoused in. So I always advocate for buying directly from the manufacturer if possible. So most families always ask me, well, what should I feed Fluffy? Should I change the diet? The second most popular question I get asked is, how long is he going to live? It's completely understandable why people ask me that question. The honest answer is I don't know. The statistics tell us that a dog with multiple myeloma who is treated with melphalan and who goes into remission, whether that's partial or complete, has an expected survival time of about 9 to 18 months. Cats don't tend to do as well as dogs do with this disease, but hopefully this newer medication will change that. I have no idea. There's only one case study, but my point is there are new treatments available for cats, and I don't always get to say that. Cats usually get the short end of the stick when it comes to new treatments. But statistics only predict what's going to happen in a population of patients. They do not predict what's going to happen in one patient. For example, I've seen patients with multiple myeloma who absolutely did not respond to chemotherapy, and those poor dogs and cats were, well, we were saying goodbye to them in just a couple of months. And I've seen dogs with multiple myeloma live for 3 years, and they weren't necessarily on chemotherapy that entire time. It is a terrible disease. It is very unlikely that we'll be able to cure them, but their life expectancy is, well, it's individual to that patient and how they respond to treatment. I do know from personal experience that we never have enough time with our loved ones. That relationship will always end. So whether I tell you 9 months, 18 months, or 5 years, I know that it's not long enough. But multiple myeloma is a relatively easy disease to treat. So if families can afford it and if they're working with a veterinarian who's willing to help them, I would encourage them to try treatment. Now, if you don't live near a veterinary oncologist, I encourage you to either reach out to a virtual oncologist like me, but there are others out there for help. We cannot make a diagnosis via Zoom or phone, and we cannot prescribe any medications, but we can work with your local veterinarian to implement a treatment plan that we can provide for them. So when veterinarians contact me, they'll give me a case summary, they'll send me all the records, and then I will send back a comprehensive treatment plan specifically for that pet. It will include what the diagnosis is, what to expect, how it will behave if we don't treat it, how we expect it to behave if we do treat it, what the treatments are, treatment plan A, the ideal treatment plan B, if this fails, do this,
how to monitor them, what to look out for, and I will also include dietary changes that might be helpful, supplements that may be helpful, and I am available for questions from the veterinarian for the rest of that patient's life. So if your pet has been given this diagnosis, please, I understand that the word cancer is very scary, but don't let that prevent you from getting the information that you need and that you deserve. I hope you found this information useful. If you did, please give us a like and consider hitting the subscribe button. It helps us out a lot. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home.